to the Policy Visibility Drive, a Ghana Health Service policy initiative created to enhance the exposure of policies, manuals and guidelines within the health sector. In this video, we will be focusing on the National Operational Guidelines and Standards for Adolescent and Youth-Friendly Health Services. In 2010, the Ministry of Health and the Ghana Health Service developed standards and tools for establishing adolescent and youth-friendly health services as part of its effort to implement its Adolescent Health and Development program for Ghana. This requires that provisions are made to ensure that the youth have improved access to the following, as outlined in the Framework on Programming for Adolescent Health and Development, recommended by the World Health Organization, which outlines accurate information to take informed decisions. Health services, including counseling and commodities, which are accessible, acceptable, equitable, affordable, appropriate, effective, and available through a range of channels and delivered in ways that reach marginalized and vulnerable adolescents and youth. Opportunities to develop life skills that will help them avoid risky behaviors and improve and maintain their physical and mental health. Opportunities to develop other skills, for example, livelihood skills and financial literacy skills, and to have access to education, leisure activities, and when appropriate, work. Safe and protective policies and supportive environments in which to live, learn, and develop. Involvement of adolescents and youth in programming health services. The goal of this guideline is to assist health service providers tailor services to meet the health and developmental needs of young people aged 10 to 24 years and to understand the benchmarks for promoting, protecting, and improving the quality of health services. Adolescent and youth-friendly health services. For health services to be considered to be adolescent and youth-friendly, they should be accessible, acceptable, equitable, appropriate, and effective from the perspective of the adolescent or youth receiving the service, the healthcare provider, and the health system. Qualities of an adolescent and youth-friendly health services provider. Providers should be technically competent in adolescent or youth-specific areas and offer health promotion, prevention, treatment, and care relevant to each adolescent or youth's maturation and social circumstances. Have good interpersonal and communication skills, including the use of new media tools. Be self-motivated and innovative. Be non-judgmental, respectful, and trustworthy. Be committed to addressing the health needs of adolescents and youth. Be discreet with client information. Features of an adolescent and youth-friendly health services provider facility. An adolescent and youth-friendly health services provider facility should have suitable hours of operation for youth and short waiting times. Convenient and easily accessible location. A minimum package of services provided on site or through referrals. Affordable or free services. Guaranteed privacy. Opportunities for youth in service delivery and planning of programs to reach their peers. Feedback system among youth for improving quality of health services. Social and behavior change communication materials for youth. Availability of service policies, guidelines, and job aids. Context-specific demand generation strategies. If you've liked this video so far, give it a thumbs up and subscribe to the channel. Comment down below as well to let us know what you think, and click the card above to view the Policy Visibility Drive playlist. Propose approaches and models for adolescent and youth-friendly health services in Ghana. For effective service delivery, any or a combination of the following approaches are to be used to deliver adolescent and youth-friendly health services. Static approach. This is where routine services are delivered from a fixed location as a standalone facility, a facility with a designated space for adolescent and youth-friendly health services, or mainstreamed into general service provision. Global approach. Here, services are offered at strategic locations, often non-health service delivery settings such as outreach points or through home visits. Virtual approach. This is the provision of information and services by employing technologies such as the use of social media platforms, websites, and mobile applications. Complementary approach. This is the use of organizations and structures such as youth groups, peer mentors, lay counselors, and support groups to provide a safe environment where adolescents and youth with similar needs interact and partake in health-promoting activities. Irrespective of the model adapted, service providers must ensure that health services are tailored to meet the specific health and developmental needs of the young person, and pragmatic measures are taken to ensure continuum of care. Please note, all service delivery points should ensure that services are advertised for the general public. Information on adverts or signboards should include the name and location, package of services available, as well as days and times of operation. Steps in establishing adolescent and youth-friendly health services: data collection, consultation with key stakeholders, select approaches, models, and strategies, building capacity, monitoring. Minimum package of services. Services which are designed to respond to the prevailing issues of adolescents in the country are outlined as follows. General health education, addressing adolescent developmental problems, nutrition, sexual and reproductive health, preconception care, maternal health, NCD services, mental health, injury prevention, sexual and gender-based violence. Implementation framework. The actions to be undertaken to meet the standard of quality health services for youth are embedded in the health sector's response in strengthening all 6 pillars of the health system, which include governance, financing, workforce capacity, as well as medicines, supplies, and technology. Specific actions are to be undertaken in each of the health system's pillars at the facility, district, regional, and national levels to ensure that critical elements of quality in service provision are met. It is important to note that the involvement of parents and community members in the provision of adolescent and youth-friendly health services is critical to sustain support and ensuring continuum of care for better health outcomes. Service providers should work together with adolescents and youth, parents, guardians, as well as community members in the provision of adolescent and youth-friendly health services through engagement with groups such as parent-teacher associations, community and religious groups, and organizations. Please note, this presentation only contains an abridgment of the policy document or publication. To access the full document or for further reading, kindly visit the Ghana Health Services website at www.ghs.gov.gh. Thank you for your time and attention.